Over the past 10 years, Americans have put the health of our children at the top of the domestic agenda. In City Hall, the State House, and Congress. And leading the charge on children's health has been the Children's Health Forum. In 2002, a remarkable group of leaders, including former HUD Secretary Jack Kemp and legendary civil rights leader Dr. Benjamin Hooks, founded the Children's Health Forum. The organization was founded to work for the prevention and eradication of childhood diseases that hit America's poor and at-risk kids, and to provide preventative health care and education to underserved communities. Ever since, CHF has been making good on that promise. Among the health issues the Children's Health Forum has tackled: asthma, which afflicts some 6.5 million children in America, an epidemic suffered especially among children living in inner cities with poor air quality. Diabetes, which is reaching epidemic levels among minorities, including Latino, African American, and Native American communities. Pediatric HIV, another disease that disproportionately impacts minorities. In fact, 85% of all children living with HIV/AIDS in the United States are children of color. Nowhere has CHF's leadership been greater than in preventing the dangers of lead poisoning for our children. The Centers for Disease Control and Prevention called childhood lead poisoning the most significant and preventable environmental health problem facing America's children. 310,000 American children have unhealthy levels of lead in their blood, according to the CDC. Most affected children come from minority or low-income families living in old housing with lead paint hazards and lead dust. The Children's Health Forum has led the charge to protect our children from exposure to lead paint hazards, and since CHF has begun sounding the alarm, cities and states across America have acted to protect our children. November 2003, St. Louis announced a plan to eliminate childhood lead poisoning in that city by 2010 and has dramatically decreased lead levels of the city's children. In 2004, New Jersey passed unprecedented funding for in-home outreach and lead testing. 2006, CHF began providing free medical services and lead screening to at-risk families in Memphis, New Orleans, Los Angeles, and Washington, D.C. In 2007, CHF, working with the U.S. Department of Housing and Urban Development, promoted the Lead Hazard Reduction Demonstration Grant Program to provide funding to localities to fight lead poisoning. Currently, CHF is implementing a statewide lead safety program in partnership with the state of Rhode Island called the Healthy Kids Collaborative. As it has fought for children's health, the Children's Health Forum has not been alone. CHF has worked hand in hand with community leaders, public policy advocates, and elected officials who have made the prevention of childhood diseases a reality. Two such champions for children are Jack Kemp and Robert Menendez. Throughout his public career as Congressman from New York and Secretary of Housing and Urban Development, Jack Kemp has been a lifelong champion of issues that impact our communities. As CHF's co-chair, Kemp has worked tirelessly to help cities and at-risk communities eliminate lead hazards and ensure children have a healthy place to live. Senator Robert Menendez has been a champion for the children of New Jersey and America. An outspoken advocate in the Senate for the Children's Health Insurance Program, he has been a voice in Congress for minority children and all people of color. Secretary Jack Kemp and Senator Robert Menendez. Their example challenges all of us to become champions for children and to join with the Children's Health Forum in bringing resources, focus, and a sense of conscience to the issues of children's health. After all, children's health is not just about medicine. It's about giving all our children, Black, white, Latino, Asian Pacific, and Native American communities alike, the most fundamental ingredient for a good life: good health.